Okay, we're here with our lovely patient from the East Coast. So her surgery was 2 days ago. We did her one-step metatarsal lengthening, as you guys can see right here, the happy toe. We also did her bunion. I have put on a nice compression bandaging for her because I don't want her to swell up, especially when she's flying today. So we're just kind of peeking through. I'm not gonna really do much. I'm gonna basically give you some betadine. What you need to do is when you take this off in a week, I want you to start putting some betadine on a gauze and just kind of like floss between the toes.
Okay.
I don't know if you did that on your last surgery or not, just to kind of keep things, because you have the pin in here.
Okay.
I don't want any kind of a maceration between the toes.
Gotcha.
You were asking me about the fifth. The fifth is not going to really bother. If you think it is, I can cut this right here so your fifth is out. Is it like pressing a little bit? Mm-hmm. Okay, so I'll cut that out right now. But other than that, I think everything else should be fine. The better now?
Yep.
Okay, so yeah, the only other thing is I also want you to pay attention to the bottom of the fourth, because the way the pin is going, it's kind of holding everything straight. Sometimes it's slightly lower than the other ones. Mm-hmm. So I don't want this area to start blistering. Okay. And some patients had that issue with the blistering, which heals eventually, but I don't want you to have that issue. Gotcha. If you feel like that's coming, what you need to do is we need to put a pad under here. Let me see if I have something I can give you, but it doesn't look like it will be, as long as you're in that shoe. Mm-hmm. But like every day, I want you to inspect this area. I will. Everything looks good. Do you have a lot of pain?
A little bit.
A little bit, okay. Mm-hmm. That's normal. Obviously, you had surgery 2 days ago, and we cut 2 main bones in your foot. Yeah. I'm gonna go over your x-rays. So we treated your bunion and also fixed the metatarsal. This is the bone graft from here to here. That's the bone graft. Okay. Long one. And then also with the plates and screws, and then the pin is holding everything together. Okay. This is your own bone. This is the bone graft. Everything looks good. How much of a lamp? Probably about close to 2 centimeters, I believe. It was. This is the best view. Okay. You see the bone graft going from there to there. And everything is held together by that pin and also the screw on top. So it's doing really good. I'm pretty happy with it. Make sure nothing changes, nothing moves. You're coming back in 4 weeks. Okay. For the removal of the pin, and the spacer is going to come out. Yep. So we got the spacer in there too, so that's another thing we did. Gotcha. Other than that, everything looks good. Keep the compression on for 1 week, so next Wednesday you can remove this. So basically what you do, you put a scissor on there, you cut all the way up. Okay. So you can remove this, and then if you want to change all the bloody bandages, you can do that too. Okay. At about 10 to 12 days is when you can get things wet, but because you have a pin, I would recommend you put it on your foot. Okay. And you shower. Okay. But for the next few days, don't get this wet. Okay. So basically just keep this for a week, for right? 1 week, yes. And then after that, just cut it and just leave the bone open? Yeah. Okay. No, it won't open, yeah. Just open the bandaging, but keep everything else intact. If you want to change the gauze and everything, that's fine too. Okay, gotcha. Yeah. I think I have gauze at home. And then how does this compare to your last surgery so far? It's different because honestly, the other one I had to have this fixator that is so uncomfortable. Yeah. Like, to me, I think this will heal like so fast. Yeah. And it's less traumatic to me. Yeah. Okay, good. So let's see. I mean, we still have a few weeks to go. Yeah. You know, till this heals, about 8 weeks. Mm-hmm. At 4 weeks, 5 weeks, I'm gonna let you start putting more and more weight on it. But so far so good, and you know where your toe is right already. You know, it's already out here. Looks good. I'll send you your pictures. Mm-hmm. Yeah, you're doing really good. I'm very happy for you.